Good? All good?
Yep.
Okay. All right, everybody here ready? Okay, I'm gonna go ahead and call this meeting to order. First item on the agenda is a review of the agenda. Any changes?
Review of what?
Agenda, any changes anybody would like to see, adds, additions, I guess?
Can you show the chat box?
Makes
Did
sense.
you ask him not to? The
Oh,
people
yeah,
are
you can put it
signing up
back.
for public comment in the chat.
You can
so
open the chat down the bottom.
As long as somebody, if you're monitoring it on your computer, Dr. Lee,
I'm-
that's fine, but
I'm gonna
somebody
turn it on
needs to
now.
monitor the
Yeah.
chat.
All right, hearing no changes to the agenda. We'll move to the minutes from the previous two meetings, both August 13th and August 28th. Are there any changes to the minutes? Anybody?
They look really good to me.
Is there a motion?
So moved.
Second?
Any discussion? All those in favor of accepting the 2 minutes from both August 13th and August 28th, say aye. Aye. Opposed? None. So the meetings have been approved. All right, Gillian will go ahead and take public comment. Just reminding those that are wishing to speak today that each individual is limited to up to 3 minutes.
Just,
Um,
oh, I'm sorry. to interrupt. Point of order, we do have a confirmed quorum.
Yes.
Yeah, okay.
And so. Up to a maximum of 30 minutes today. So Gillian, or who's managing the signups?
So we only have, well, now there's 3 individuals wishing to speak, but Diane Blust is the first.
Okay. Please go ahead.
Okay, there. Can you hear me?
Yes.
Okay, let me get this out here. Good morning, and thank you for the opportunity to speak this morning. My name is Diane Blust. I'm a Jefferson County resident and a board member of the Jefferson County Foundation, a 501c3 nonprofit established to promote sustainable development and protect the environment of Jefferson County. This morning, I want to draw your attention to a potentially serious industrial pollution issue impacting the waters of Jefferson County. In July of this year, Rockwell reported to the WVDEP, that's the Department of Environmental Protection, elevated levels of aluminum in its stormwater discharge. You may be aware that the Rockwell factory is in a particularly sensitive part of the county due to the karst geology and the multiple sinkholes in the area, specifically at the Rockwell site. My foundation has a water monitoring program in place to check for industrial pollutants in the waters of Jefferson County. In April 2021, we engaged a third-party qualified testing laboratory to carry out water testing in numerous places, including a spring in Elk Branch, a tributary of Elk Run, which is the primary water supply for Harper's Ferry. We found no detectable aluminum at that time. That's April. When we learned of Rockwell's aluminum discharge in their stormwater, we arranged for a second test at the spring in August and found 189 micrograms per liter of aluminum in the water. This is just 11 micrograms below the EPA limit of 200 micrograms for drinking water. Our foundation is addressing the flaws we see in Rockwell's stormwater permit, and we have informed the WVDEP of our most recent findings. We have ongoing concerns about inadequate protections in place to protect the region's waters from Rockwell's operations. As the county board responsible for the health and safety of the waters of Jefferson County, we wanted to make you aware of this issue. We have provided this information to the health department in an email earlier this week. And should you have any questions or require additional information, please contact us at the email address in that email that we sent to the health department. Now I want to take just a moment to speak strictly for myself and not for the foundation. I also want to urge you to do your job regarding communicable diseases and epidemics as outlined in the West Virginia Code. You should be urging citizens and organizations to follow the best science and public health guidelines, not using unverified information to promote a political agenda. When it comes to masks in school, this means following CDC guidelines, not comments from America's frontline doctors. Thank you.
Thank you.
And next is Monica Taylor.
Hello, good morning. Can you hear me?
Yes.
Okay, good morning. My name is Monica Taylor. I am a parent and a concerned resident at Jefferson County. I emailed the health department on Tuesday, August 31st with some questions that I had regarding masks and quarantines regarding COVID-19, and I never received a response. I don't think that a public service organization should be ignoring residents regarding any issue. And I know that everyone is so tired of hearing about COVID-19, but there are legitimate questions that we have, like how long will the quarantine be in place? Is wearing masks sufficient mitigation to avoid the quarantine policy? And what conditions need to be met until Jefferson County residents are no longer required to quarantine due to COVID-19? This really goes directly towards concern about, yes, of course, public health, but with a survivability rate of 98.225, and for children 5 to 11 who cannot receive the vaccine, but still have a 99.989 survivability rate, it is very frustrating as a parent, as a single mom or a dual income parent, to be weighed down with the threat of quarantines in our school. What are parents supposed to do? This really creates a lot of hardship. We had hardship already, and I know that thankfully in our school we haven't experienced the quarantines yet, but I just feel that it's this pressure that could be coming. So I would like answers to my questions. I don't think that it is okay to ignore questions from residents when we really do have them. We would like to know, and I just would like to bring that to your attention. Thank you.
And next is Amy Lindsay.
Yes, good morning. My name is Amy Lindsay, and I'm a resident of Jefferson County. I was just wondering when you're going to revise the letter that you sent out. I guess that was last week before last. Given that Jefferson County is now in the red, shouldn't we be doing everything possible to reduce the spread of this? I mean, the speaker before talked about the hardships, and she's absolutely right. Unless we all get it together, wear our masks, and get vaccinated, we're not going to be able to reduce the virus in this county. And the data over the last week shows that it is absolutely exploding here. And I would like to see some leadership out of this organization. You're supposed to be, looking after the county's health. And it's time that people hear a very strong message about vaccinating and wearing masks, especially given the fact that about a quarter of the cases were for school-age children. Right? That's what the most recent data says. And without the masking and vaccinating, the virus will continue to spread. People will continue to have hardships. So that's all I have to say.
I didn't see anybody else signed up for public comment. If there is anybody else who would like to speak, please do so now.
Hi, is this okay to just go ahead and unmute?
Yes, that's fine. And what is your name?
Hi, my name is Tracy Phipps, and I have one child in school in Jefferson County at Shepherdstown Elementary. And I would just like to say thank you for the memo that you sent out, allowing parents to still have a choice on whether to send their kids to school with or without a mask. I think it's very important because all kids are different, and I really appreciate that you are allowing parents to make health decisions for their children. Thank you.
Thank you.
I don't see anybody else signed up for public comment. If anybody else would like to speak, please let me know now.
Hi, can everyone hear me?
Hearing none, this will conclude public comment period. Thank you all for taking the time. Oh, sorry.
Sorry, can you hear me?
Can't hear you. Sorry. Now we can. Now we can't.
Can you hear me now?
There we go.
Okay. I'm sorry. Yeah. Just to reiterate what the lady who just spoke said, I appreciate the fact that you are allowing parents to make that decision for their child, particularly in light of the fact that according to publicly available data, no children in our county have died from this disease. It seems like also the case numbers are relatively low given, the hospitalizations are relatively low given even just the case numbers as well. So just wanted to reiterate, thank you very much for allowing this to be a parent-led decision.
Thanks. What's your name?
Oh, I'm sorry. Can you hear me again?
Yep.
My name is Patricia De Leon, and I live in Ranston.
Thank you so much.
Sure.
What was the name of the previous lady?
Jess. Oh, Tracy Phipps. I thought I heard Jesse.
Tracy what?
I got Kay Phipps.
Tracy what?
Phipps.
I got Kay Phipps.
P-H-I-P-P-S.
Patricia dealing with them.
Yeah.
I don't know if that's right, but
I had put Deland.
Okay, all right.
All right. I think this now concludes public comment. Thank you all for joining us this morning. Where's my agenda? Oh, it's right. I'm writing on it. Hello, sorry.
Same thing I did.
It's been a long week. All right, so we'll move on to unfinished business with the update on vacancies, excuse me, not vaccines. And I think we've got potentially some good news, hopeful news.
We do. We have hired 2 new employees. We have our new threat prep coordinator, Mason Michael.
Nice to meet you.
welcome, Mason.
And we also hired a nurse director. She can't be here today, but Laura, what is Laura's last name? It's Shepherd, Laura Shepherd.
Is that the lady that I met on the
Yes.
way out last time? Oh, great, good.
Yeah, so we do have 2 new.
What was her
hires.
name again? Laura
It's
Shepherd.
Laura, she is Laura Dana, but she goes by Laura. And in other vacancy news, we did have our one office assistant up front leave. So she put in her 2 weeks notice and her last day was Tuesday. So now we're short 2 office assistants.
We're short 2
Office
office assistants.
assistants.
Oh, okay.
Where are those posted now, like the vacancies posted on the website?
We're waiting for DOC to get back to me with the list.
Okay,
So because they were previously posted and they told me to just redo my requisition request, so I did. And I'm still waiting.
So
Just
they
like
have-
we're still waiting for the administrator requisition. to
Right.
come through.
so they have candidates from the last time.
Well, that position is always posted on the state website, so
Okay.
they can just refer new candidates that are willing to work in Jefferson County to us.
Gotcha.
Yeah.
Okay.
How are you covering that position?
Right now, Mason's been helping and Wendy's been helping up front, and the nurses help too.
So if you're the threat prep, that's a pretty substantial grant every year, correct?
Mhm.
So are you responsible for a portion of acquiring that grant for your position?
I believe
So he will be doing a lot of parts of it, but the grant also helps fund other positions because we all have to be trained and respond. But he will be the main, his salary will be one of the main ones, but also he's going to be responsible for getting all the reporting pieces done, which is quite a lot. They need quarterly reports of how it's spent and then attending a lot of different exercises that will occur. Several.
But you are specifically, your duty is to submit for the grant, or whose responsibility?
Right, so we call it a threat preparedness coordinator. That's not his own, could be his only role, but it will largely fall to him.
Right, but who makes sure that grant is submitted and acquired?
And I,
Overall, the administrator has to do that. The administrator has to sign off on all of those grants, the invoices and everything. So it's the administrator's responsibility to submit the invoices.
All right. The proposal to the state personnel board.
Oh, yes. So
How's that going?
it's, I've worked on revisions for it for them based on what they said they could do for us. So I'm not sure if that's going to be on this September's board meeting or not, because I haven't heard back from the people in the Department of Personnel office who are supposed to be working with me on that.
Okay.
So, all right, so we'll see. But basically, since we hired 2 of the positions, they were willing to work with us on our vacancies to get higher rates. So I'm not sure if they will still allow for us to get a bit higher rate for the threat prep coordinator starting position, because it's just not, it starts very low.
Right.
So too low for somebody that you're wanting to have a bachelor's degree in order to do the job.
Right.
So.
So I had talked to Senator Rucker a little bit about this, just about the short staffing in general. And so she has offered to help. She's, I guess, done for another, I don't know which other agency, but sort of helping sort of manage through some of these requests or whatnot. So I think it would be, I can happily put the 2 of you together, because obviously I don't have technical elements of what it is that you're trying to do, but see if she can maybe be helpful, because she has extended that offer.
Okay.
So, and has been successful in helping with that elsewhere. Oh, I see. And Anne, I don't know if we've reflected on her attendance, but Anne is here.
So
All right. Bylaws. Is Steve Grow on today or?
I am. I'm virtual. I just have myself blocked out. How are you all this morning?
Hey, Steve.
I sent you all out some revisions to it, and I tried to put them I did some reorganization, but all the additions were in bold. And I don't know whether we just want to walk through them or whether you have any specific questions, or some things I tried to do was to make sure just some housekeeping with the way the code looked. And then I wanted to put the 2 and 3 day notice thing pretty clearly in there. So we make sure, in the future that people know what the time frames for the meetings are. And I don't know, I think everything else should kind of be straightforward, but I don't know whether you want me to walk through them or are there any specific questions?
Any
I have
comments?
specific questions if you don't mind.
Absolutely.
When it comes to the chair, is the chair a signature on the checks?
Only when, yes, they are.
Right,
Chair.
so how many signatories do we have for the checks?
We have 2.
We have 2. Is there a requirement of 1 or 2 signatures?
It's
It's actually a requirement of 3 signatures because the sheriff has to sign as well.
I see.
So it requires the health officer, and somebody from the board, because both have to approve that, and that's the easiest way to have them approve it.
And then the sheriff does the
Yeah.
last one.
So there's, Dr. Reedy has to sign. And the sheriff has to sign. So do you have, is there only one qualified on the board to sign, or are there two?
There's
So-
two, so if the chair is not available, the vice chair can.
Gotcha. All right. And they're on the bank signatures, the signing.
Yeah.
Okay, that was my question there. Health officer. When it comes to correspondence, the health officer signs the correspondence. But is the correspondence, is there oversight from the board on the correspondence?
Not typically. It depends on what the correspondence is, but most of our business correspondence, the health officer would sign off on it without oversight from the board. We wouldn't have time to have the board meet every time we had to sign something and get it to the state.
Okay, well then, is there some sort of review process where there could be somebody or committee from the board that just reviews the correspondence as it goes out?
No,
Well, why not?
because in my opinion, it doesn't make sense. The board does have specific duties, but they don't need to oversee all of the everyday business that's happening.
No, I didn't, no. What this board is, and what boards should do, is they actually provide the oversight so that you review the processes over time periods, right? So when it comes to budget, and when it comes to correspondence, and when it comes to every day, there's no way to review the performance of any particular person who works for the board unless the board can see, has some sort of access to see what goes on.
The employees are supervised by the health officer and or the administrator. So there's oversight there. You hire a health officer, you
Exactly.
hire an administrator, and they have the oversight for the rest of the employees and their performance.
Right, so then the only way for us to have oversight over the administrator and the health officer is to be able to review the documents that happens, just to do a review. And that way, the board can assess the performance.
And we
Right.
have allowed the board to come in and review documents
Okay.
before.
That's all I'm asking.
Is it, are you asking for like after, so like,
Yes.
here's the month's correspondence, not like a daily oversight of what goes out the door?
No, I'm not
Okay.
saying that the board needs to approve every piece of correspondence, but just that, okay, we have the access to the records, I'm fine. Just wanted to clarify.
Most of these pieces of correspondence are merely business things that they need to take care of on a daily basis, whether that be reports to the state or communication with other health departments or through the state. It is not by any means a decision-making thing that they are doing. They are just simply doing their jobs. If there is a decision-making letter that needs to be sent out, we have been involved with that in the past.
Well, we do make, like sanitarians make decisions on a daily
Right.
basis. They deny lots. And we
Right.
send out those denial letters with our authority, not because
the
we're the
board.
ones that have the
Right.
authority to do that. So.
But I mean, I've served on a lot of boards, and the fiduciary responsibility of a board is simply to assess and review and evaluate the performance. You two are the key employees, and certainly not the day-to-day operations. I didn't mean to imply that at all, because the day-to-day operations are yours. But the board is here to make sure that everything goes right. That's what we're here for.
Most of our correspondence is now electronic, and it's all day, every day.
Right.
In some areas, the health officer, some of my actions would actually be medical and person specific, and those would not be reviewed.
Right.
Because confidentiality issues, but we do try, and if they're going to be significant operational changes, and policy type things, then we keep the board informed or at least the chair, who then will say, no, we gotta talk about this more, or, but it's pretty much go by what the state directs us to do, in that we have joint oversight, and
Lucky you.
and so there's always a little bit of deviation, because things that come down from the state don't necessarily work at the local level, and they are changing things, especially during the pandemic. They're changing things frequently, so we have several times a week phone calls with different groups of the state. So we will make a pretty sure effort to keep the board involved in things that are a big change, such as if we start doing more opioid related things, or other outreach type clinics that are different than what we've done. So we want to be transparent and guided by basic public health standards. The state is moving towards more standardization of local health departments, as is the nation.
Thank you, perfect, appreciate that.
Any other questions? Elliot?
No, I have no further question.
I know I've got a couple, but I don't want to step in front of anybody. Do you have any questions, Ann, or
No.
David, or Ann?
I'd like to add one thing before we get started. After I sent these out, I noticed that when I revised them, I took something out which probably should be in there just for clarification. There was a section about telephonic attendance and written consent, which I took out, but because the written consent thing was old. But I think I'm going to add back in on section 7 to make it clear. So in case it comes up in the future and no one's there, that members of the board can participate telephonically or by video conference, and that counts towards a quorum. I think that's true. I just took it out, but I think I could receive a time in the future when someone raises that question, and I might as well leave it in there, because just to clarify in case someone's.
Yeah, more importantly now than ever, because I remember looking for that specifically in the previous iteration.
And I took, there was this thing about written consent in there, and it was in with that. And the written consent thing I think was old, and it's not workable, but I shouldn't have taken out the telephonic thing. So I added that back in under 7, attendance, to make it clear that you can attend telephonically or by video conference. I think what was in there was true, just so everybody participating in the meeting can hear each other. That's the important part, and it counts towards a quorum.
Well, actually, shouldn't it, instead of telephonically, shouldn't it just say you can attend remotely?
By video or telephone.
I could do that.
Yeah, okay.
There is one question or just clarification, Steve, on section 3. This is a change from the previous. The public shall be provided a notice of an agenda for the meeting, just regarding special meetings, of at least 2 days prior to the meeting. I know prior we had that as 5. Is this just because we're going to be now in line with the state's open meetings laws, or what's the change there?
The 2 and 3 days, which for regular and special meetings, which are a couple places in here, that's the Open Meetings Act floor. You can require more than that, but I think like we had with that issue on having to have a Saturday meeting, if you set the requirement longer than that, then you have to abide by that. So you can always give out the notice earlier, but you can't, it would limit your flexibility. If we need to have a special meeting, but we say 5 days or 7 days, then we have to have 5 or 7 days. We can't drop off of the thing. This is just what's required by the Open Meetings Act. I mean, I think we should probably always, aspire to get more than the minimum, but I didn't want to limit your flexibility in case something comes up that you need a special meeting.
Yeah, I just want to make sure it was consistent with state law and have that clarification.
Yes, ma'am.
And then the other question I had, and this is not something that's in the bylaws right now, is, and this sort of came up in, I think, the last meeting, because I know some of the other agencies, I mean, certainly the county commission posts its video / audio, along with its minutes or, after the meeting. And because I guess we're probably going to be in this hybrid format for the foreseeable future, if not forever, can we put that, or would you all entertain the idea of putting that into our bylaws, that we actually do post our video and or audio of our meetings after the meetings are complete?
Yes.
So what time frame do you think is reasonable for staff to post that at that time?
I don't know. I'm not sure how you're wanting to have it posted. I would have no idea how to post the video. That I don't use YouTube. I don't, so.
Yeah, the ESA actually posts a video of every meeting on YouTube. They have a YouTube channel.
And I don't know how easy it would be to upload the video to our website.
Well, I think the YouTube part of it, because then you can link it, but do you know what the video format is of these recordings?
No.
Okay.
I sent them out, but I'm not sure.
Instead of being in the bylaw, can it simply be a directive you give to us? And then you don't have, it's something that's more flexible. Because that starts to get,
I think it makes sense. I mean, to give the information out as you want. I don't know whether we want to put it in the bylaws, because suppose something comes up that we have a technical problem, we can't do it. Then do we have to delay our meeting because we didn't do, I mean, I think you can always tell the staff to do that, but I don't know whether we want to make it a requirement of them. I just want to create us a situation where we didn't post the video of the last meeting, and then that creates an issue where.
Well, according to the Open Meetings Act, we're supposed to be posting minutes to the website, and they're not there.
Yes, they are. That's all been rectified.
That's been
If you've
rectified.
seen it,
All right.
yeah,
Okay,
they
well,
are.
last I had checked, so that's right. Good, okay.
And I would agree with that the time frame of the postings is probably not quick enough for the public.
Yeah.
I mean, we saw that happen last meeting.
It's perfectly understandable if there are technical issues that if you don't get, if you just say, barring technical issues, that they should be posted within 72 hours of the meeting. I don't see the harm in that, putting that in the bylaws, because that should.
What should be posted within 72 hours?
A video.
Because minutes don't get approved until the following
Right.
meeting.
I'm not
so they
talking
don't
about the
get
minutes, I'm
posted until after that.
talking about the video.
But then you're putting that on staff, and these meetings are on Fridays. And to figure out how to do that, for one, we don't have enough staff as it is right now. We don't have staff that has that technical expertise right
They
now.
make it within 5 business days or 10 business.
Is that something like a
Whatever's
board member
comfortable.
could be helpful with? Like, I'm happy to volunteer my time. It's not.
When I try to send
Super
those out,
complicated.
it just creates a Google link, and I have no idea how to even do anything else with it.
Yeah, I had trouble getting it open. She had to send me another.
I think we can find a way to do it, and I think I'm willing to help, and I'm certain that the entire board would help. My concern is that I'm hearing no, there's got to be an answer of how we can get it done without stressing anybody out.
Well, I think we need to recommend that you try to do this without putting a real time constraint on it at this point in time, and see what we can get done and answer that question next month. And hopefully you'll have a little bit more office staff maybe.
It's not like we have a secretary who can help with these things. I'm the one who does all of the minutes for these meetings right now. I have for several months. So while I was out, Dr. Reedy did the minutes.
Well, I know how to post a video to YouTube. I can do it, and Karen can do it. and David can do
We're
it.
offering the help.
Every
We're
one of
actually
us.
not putting it on you. We're
We'll
asking.
volunteer our
I'm
time to
saying
do it.
When you have issues like that you want us to do, you're adding more to it.
Right, but we're offering a solution to take that on
And that's
Right.
fine.
until the proper staffing.
But
Right.
like I said, when I'm trying to even send the video to you, it's just a link. So I don't know how you're going to.
We'll figure it out. We won't
Yeah.
put it in the bylaws, and
Right.
we'll figure it out and come up with a solution.
Right.
Does that work?
Yeah, we don't have an objection to it being available. And we're willing to do it, but in the bylaws, then it's a solid thing that everything else has to stop because it's in there. And so, but certainly if that is now the desire, and that's the standard, then we don't have an objection. We just have some limitations, which hopefully will be remedied shortly with better administration.
Yeah, I mean, look, at the end of the day, any member of the public every month can sit there and FOIA the document. So, I mean, that's gonna be just as much staff time to be able to figure that out. So, I mean, we're willing to hear that we're willing to help and take that on in order to make it happen. And I think I'm hearing agreement, we don't put it in the bylaws. Is that correct? I hear not.
I agree.
What's that?
To not put it in the bylaws, but
No, I
instead
think
for
we
it
should-
just to be a practice that's adopted.
I think we should, I think even just to the extent of, we'll use our best efforts to post the video of the meeting in a timely manner, and whatever that turns into, just as long as it's prior to the next meeting that comes up, I think that would be fine.
Let's not give them a mandate to do something until we can get it figured out.
Well, I think the directive should be that they get us the link as soon as possible, and then we'll figure out at least this go around what how to technically do it, and then.
Right.
The other concern is we need to, editing is always a possibility, because if we forget to stop the recording when there's an executive session, then that has happened in the past where I've forgotten to stop recording during an executive session, so we wouldn't want to post that piece of the meeting.
Right.
So and I don't know how to edit videos either, so hopefully.
We can get there.
So maybe there should be a motion that by the next meeting, there's a plan in place for a time frame.
Post the video.
You have a motion in mind?
Well, right now, we're in the
Yeah,
middle
we're-
of
Yeah, we're
the
reviewing
bylaws.
We
So-
can make a motion to new business.
Yeah, I was gonna say, let's put that down there. Video. Okay, back to the bylaws. Any other discussion, questions?
I have one more. Mr. Grow.
Yes, sir.
You didn't put anything in the bylaws regarding the position of a recording secretary.
My recollection was the Dr. Reedy was required to do that.
Well, there should be a position called recording secretary. If he wants to be the acting recording secretary, that's absolutely fine by me because he does a great job. But I think we can find a recording secretary because I think there might be better things for Dr. Reedy to do with his time.
And my recollection was that he's required to keep the minutes of the meeting. I mean, I think by the statute.
Is that right? Okay, well, that was my question. That's why
Right.
I asked.
So no sense, I mean, we wouldn't, he has to do it anyway, so
Okay,
that's why I think we left it out.
okay. You might want to insert that there's a recording secretary, and by statute, it's the medical officer.
So previously in the past, actually, many moons ago, and Ms. Smith would probably agree with me that the threat preparedness person was always in these meetings taking.
Well, she was doing it as an employee and a directive of the medical director, I think, at the time. I think the responsibility actually falls with technically Dr. Reedy or the medical director in whomever he may appoint to do that. And the time that Caitlin was doing it, she was doing it on the.
Dr. Reed can designate staff. to do
Right,
this.
exactly. But I think the responsibility is basically on the medical director to do that.
I think Caitlin also posted the minutes previously online.
Yeah, Caitlin was pretty much our techno person when she was here. And it's been a job that hasn't been filled by anybody since she's been gone, but now we have Nathan.
Now it's still- could be
And then
still
hopefully
good.
our administrator too.
Right, it could be something.
I'll
administrator
get
could
you that
delegate.
code where it says it.
So is there any thought on adding the office of recording secretary to the bylaws? And that it's determined right now by statute?
I guess because it's in statute.
It doesn't
It
need to
doesn't
be.
need
It doesn't
be
need
in
to
the
be.
bylaws.
explicit.
So do we want a motion to accept these with the amendment that we can participate remotely in attendance to be counted,
To be added in.
to be added in? And other than that, it's okay,
Is that your motion?
well, I'm asking, do we have to have them retyped again before we make a motion to approve them?
One of the reasons I did this remotely is I'm here at the office. I can make the changes, email it to Gillian, and she can have the chair sign it before she leaves today. So and you can see a clean copy.
Okay.
Okay.
So I move that we accept the bylaws as written, with the exception of adding a phrase to the attendance that we can participate remotely.
I'll make the second that we approve the bylaws as amended.
Sorry, any discussion? All those in favor?
Aye.
All those opposed? All right, the motion passes.
And I'll email them out before the meeting's over.
Okay, thanks, Steve.
Thank you.
That's what it says. That's what it says.
Okay, moving on to the one-time pay stipends. What's the latest on that?
They were approved and we paid them there today, so all the
Awesome.
employees received them today.
Awesome.
That's great news.
That's really great news. I'm so glad. Thank you for making that happen and finding that way with the state. We're able to accept that.
And this fits well with the transition of our bookkeeping system from payroll to one done by the accounting firm, because there was a slight shift, and this actually covered that gap very well.
So employees were only going to get paid for 1 week of work today to fix that. And this happened at just the right time where we could give them that bonus when they were getting a smaller paycheck.
Great. Excellent. All right, moving on to new business, update on COVID-19 activity and vaccinations.
Can you put this, the screen share? And I'll ask you to go over the slides. Find that, open that folder. on the screen. File open.
Whenever we get into new business, do we want to get a clarification?
Can you share
Actually,
screen
let's-
with me?
About.
You have it on your.
Yeah,
Do you need
responding
it on
to
yours,
those
or do
It's
you
on
need
the-
it?
I have it right here. So I actually have a recommendation on that. It's something the policy I use.
emails.
So the number of cases has again increased. This is since the start of the pandemic. If you can minimize that. You can see last year at this time, it was not so many cases, and then through the winter, we had a lot. We in Jefferson County had another second wave in mid-spring, and then we were down in June and July to very few cases of 0 to 1 case a day through early July. And that has increased the last 2 days. We've seen 50 and then 40 new cases a day. So this is not, we keep looking for these curves to level off. They have not yet. This is comparing the same month time frame last year in the green. So you can see when this first started back in June, when the Myrtle Beach event occurred, everyone panicked, and you can see how small that was. And then in October, coinciding with school opening, people moving inside, we don't know the exact causes. People say voting, people say Thanksgiving, but there was a steady increase, and it lasted through the winter, and then started coming down before many people had been vaccinated, though that may have helped individuals. It was coming down in mid and late January, and then improved, but now we're up again, and we do not know when that's going to change. This is the state. We're just like the state and the nation. The number of cases per population has increased even in the past week, and the number of tests that are showing positive results have both increased. The number of probable and confirmed cases, that's a confusing thing. We view them as pretty much the same in management. It just depends on which test is done. But those numbers have increased in the percent positivity. You can see the number of tests being done has increased also. Excuse me. Sorry. Somehow that went forward further than I wanted. We have been vaccinating. Originally, we were the lowest county back in early February. We had the fewest, and that had to do with what was allocated to us, because everything was allocated was given. We're now about the 15th best county out of the 55. But you can see people that have received 1 dose of the total population. That's about 50% or half. And those who are eligible, meaning 12 or above, 58, 59% of the eligible people have received it. So the easiest thing is just to say half of the population has been vaccinated. The fully vaccinated, it's lower. The number that we're giving daily in Jefferson County is not increasing despite all the messaging. So some of these are second doses, some of them are first doses, but we're averaging, maybe 30 to 40, and this is all the pharmacies, medical practices, and health department together. These are the confirmed hospital cases, and you can see we're approaching the all-time high from last winter. If you look at who's been hospitalized, the majority of them are unvaccinated. Remember, 50% of the population, or 57% of the eligible, have been vaccinated. So if the vaccine was not having any effect, you'd expect this to be 50-50 as far as who's sick enough to be hospitalized. There are indeed people who are vaccinated who are getting infected and getting sick enough to be hospitalized. This is the number who are in ICU that exceeds the previous all-time high. The ICU beds is not simply beds, but also staff and equipment to do that. And those beds are competed. We are competing for those beds if we have a heart attack or a motor vehicle accident or something else. This is true through all the referral hospitals too. So if you have something you need to go to Fairfax or WVU or Hopkins, they're having the same issue and there may not be beds available. So this is a real time thing that impacts healthcare other than medical care, other than just the COVID. Hospital, those sick enough to be in the ICU, again, there appears to be, as you heard on news conferences, a significant decreased likelihood of needing to be in the ICU if you're vaccinated.
Is that number from West Virginia?
This is West Virginia. It's on their website. Number of people on the ventilator. So those are people who are sick enough that they cannot breathe on their own with other support. And also people who were, by their decisions and decisions of family, they are people that, you know, they're not someone that's end of life, and the ventilator was considered futile. That's an individual decision, but these are people who are thought to be, you know, someone who should recover. Again, the ventilator, you know, most are unvaccinated. Breakthrough cases. So indeed, there are people who have been vaccinated who get infected. Again, this is West Virginia data. So there have been 7,000 people we know have been vaccinated who have gotten infected. But that's a small percentage, again, 50-50 as far as who's been vaccinated or not.
What is the hospital situation locally? How many do we
So I
have?
do not know the exact number in the hospital. I don't get that information. So this is the average number of new cases, similar to what I showed for Jefferson County for the state. And it looks at the number of cases who real time who are vaccinated or unvaccinated. Again, a remarkable difference. If it had no effect, you'd expect them to be similar. So those who say the vaccine prevents you from getting it, it does not. It decreases the chance, but it's not perfect.
I heard that the CDC, their definition of vaccinated is that they don't consider somebody vaccinated until 14 days after they've gotten the vaccination. So
so we put definitions just to be sure we're counting things the same. The definition of fully vaccinated, meaning they're having the maximal impact. So if I get a vaccine now, it's not going to have any impact on my immune system right away. It's going to take some time till the immune system can respond. Just like if I take an antibiotic, it's not going to suddenly work. So for each disease we would be vaccinating against, how long it takes till you get benefit and whether you get full benefit after 1 or 2 vaccines is different. And for each vaccine, some vaccines are remarkably effective in 99% of the people having complete prevention of the disease lifelong, such as hepatitis A. Others are not, well, others never make it to market because they're not even good enough. Back a year or so ago when they were planning this, they said if it was 50% efficacious or effective, they would consider that enough to authorize use. And it came out 95%, which is far beyond anyone would expect. But So they were not expecting that this would completely prevent, but if it decreases. And so this does show, so this is real-time information that shows that there is a marked difference even with this variant.
And with these cases, is there a differentiation between, you know, your classic COVID and your variants?
So not every,
Is there a test for these variants?
so,
'Cause
yes,
I've heard that there
so
aren't.
a certain number of cases, it depends on the laboratory, they have to be sent to a special lab, so that's a WVU. So the Berkeley Medical Center, for example, sends 100% of theirs to be tested. We don't get the results right away, and I'm not getting the results now anyway, we're just getting the state average. 97% of the positive cases that are tested to see what variation of this virus is are Delta now in West Virginia and across the nation. And that's much different than 2 months ago. So the United Kingdom variant, the original virus, this COVID, those have been replaced.
And the testing, the CDC has abandoned the PCR test. They're actually saying that it's not a good way to, it's not a diagnostic tool at all.
I'm not sure that I've heard that.
Yeah.
Because that's what I have to use to travel to Canada.
It depends upon the number of cycles you use. Like the inventor of the
So there
test
are
says it wasn't good.
specific situations where there could be a person who has a test that's positive and we have no reason to think that they are infected, and we repeat it, it's negative. And so the definition of what's positive and what's negative is specific for each test, just like measuring anything. And we have a cutoff, but that cutoff is artificial based on statistics. So there are going to be a few people that fall outside that. But in deciding the usefulness of a test, we have what's called predictive values. And some of that depends on the population you're testing. So if you're testing a group that's highly likely, such as a symptomatic person who has knowingly been exposed, their 5 family members have it, they've got the same thing. And if they test negative, then you'd say, I'm not sure I believe that test. If somebody who's been completely isolated and has no symptoms, and they get a random test for, they're going to have a colonoscopy and it's positive, you're going to say, I'm not sure I believe it, because they're very unlikely. So some is the pre-test probability. And that's something we put in there. And there are individual cases where we'll say, this doesn't fit. And then we go back and look at it. The same as if we get a potassium level that's way off, we say, let's recheck
But
that.
that,
Measure twice.
but all of this calls into question the value of the test itself. That's all I'm saying.
It's like every other test is, it has to be taken into consideration with everything else. So the majority of the positive, the overwhelming majority of the positive tests I see fit the picture.
And we're still using the PCR test?
The PCR is still the best test, and they're different. You know, if you know a different one, show it to me.
Well, the PCR test is being discontinued by the CDC because they're saying it doesn't have the value that they thought it did.
Yeah, I'm not sure what you're alluding
It's
to.
The PCR test, the CDC guidelines, by December, nobody's to use the PCR test. That is now the standard MO.
Well, like clearly there's maybe, if there's a source or whatever, maybe share it with Dr. Reed to clarify, because
Okay.
if he doesn't have the information, I don't think he can
Okay.
really.
Yeah, so it is
properly
still the guidance,
Okay.
current guidance. What our
Because
situation
there are
will be
other
in December,
tests.
we will
There's a
see.
saliva test that West Virginia Labs is now providing.
That's a PCR test.
Yeah,
It's
but-
just, it's where the sample is obtained from.
So I don't know, I haven't seen anything about them discontinuing PCR testing. That's pretty much the standard for many test is PCR.
Hmm,
Elliot,
Supposed
Elliot,
we can have that discussion offline.
I think Anne has.
Elliot,
Yes.
these tests of PCR is what I read is probably some a specific test that they have some issue, and they probably have put a restriction on that. But these tests are PCR because we just measure the frequency of the RNA.
All right, I'll send you the information.
So what about therapies? I see all this data.
So
There's therapies, and what's the mortality rate? How is that trending? Because just because cases are going up, that's a negative, but are the therapies better or the death?
So
rate
so there are therapies that are done. There is a monoclonal antibody. Originally, you heard about getting plasma infusions from people who've been previously infected. And so those were antibodies from the many antibodies the person could have made. Unfortunately, that did not turn out to be beneficial and was cumbersome, but there is a specific antibody that can be made wholesale and infused as a reproducible product, just like an antibiotic. But this attacks the virus just like antibodies we make in response to a vaccine. And in individuals with specific health problems, being old, like over 60 or 65, and other medical problems, even if you're younger, that can be valuable in decreasing the chance of severe illness in nursing homes. Giving the antibody treatment has now become pretty routine, that when we have someone positive in the local nursing homes, they get the antibody. It is being administered for select cases here in Jefferson Medical Center. And there is their capacity as of yesterday, their capacity to do it, they have 8 beds, it's an outpatient infusion. They have 8 beds now, but they're not allocated enough that antibody to be able to give everyone. And that's something we've seen throughout the pandemic.
So how does the death rate of COVID currently compare with, say, the annual flu? So if I have the flu, and I have COVID, how much more likely am I to die of COVID?
So the flu, and that's going to be the crucial question going forward, is at what point does this, so COVID is not going to go away. So very, very early back in February of 2020, they said, can we contain this and eradicate it like they did with SARS? The answer quickly became no. It's out of the box. It's here. But it's not like the flu in that there were about 600,000 deaths so far in this country. Normally, there are about 50,000 deaths from the flu every year. So we have, as a society, accepted as part of our norm is that 50,000 deaths from a respiratory virus we live with it. I mean, it'd be nice to not have that, but we're not there yet. But you can see in the ICU numbers, the number of people getting sick enough to be in the ICU is as bad as it was or worse. The hope is that immunity, either from a prior infection that you survived or from vaccination, is that your immunity will be able to help you fight a future infection. So whether it's natural immunity from being infected or the vaccine, currently that does not confer lifelong immunity to this virus, which is expected.
How many monthly deaths are there on a national basis? If you say there's 50,000 annual for the flu, how many are?
So I do not know. Currently, I can get you that answer.
Yeah, it'd be interesting to compare that to, if there's 4,800 deaths a year or
So
a month from the flu.
So let me just show you. So this is the next slide. So this is the average number of deaths in this weekly average number of deaths in the state. Now, this is not a week by week count, but so currently the number of deaths, both the vaccinated and unvaccinated, has decreased in the last few days. And we'll just have to see if that trend holds. And that's going to be very key because our concern is anyone dying. Of course, our concern is especially those who would otherwise not be close to death. So I do have people I talk to themselves or their families who are already on hospice, or they're known they're dying from something else and they get COVID, just like you could get another pneumonia or something else. And so they die with COVID. If they fell and broke their hip, you'd say they died because contributed by falling and breaking their hip, but it was because of an underlying disease that they were so frail. So, but most people are not, who are dying from this are not people that you were expecting their death in the next month. And some of them are middle-aged and rarely younger than that, and quite rarely be children. Children are more likely to die in a car accident than from COVID. And we just, not that we want car accidents to continue, because COVID does not suddenly become worse. But they can transmit the disease to someone else. A third of our over 60 and I think 20% of our over 80 population have not been vaccinated. So we still have a lot of people who are susceptible to having very serious COVID. Those who have been vaccinated in that group, though they still could get it and die, are at less risk of being hospitalized.
To your opinion, the people that are vaccinated, are they being more of a risk of being meeting death over COVID than they are the flu?
I'd say that again.
People that are vaccinated, are they any more likely to die of COVID versus the flu?
So I haven't seen an analysis of that. And this is the first peak we've really been able to see real numbers, because a few months ago we were not seeing many cases, so we didn't know. And this is the first real test of what's the benefit of the vaccine. And it is possible it's approaching that kind of number, which would be good. It'd be nice if it's even better. But then we'd say, okay, this is something that is at an acceptable level, that we accept that as part of our background. This is going to change from an epidemic to an endemic, meaning it's just part of the normal stuff we deal with. And hopefully that's going to happen quickly as more and more people have immunity one way or the other. So at some point, just like earlier you saw things dropped off in the winter without clear explanation, and we have all sorts of rationale for why that may have happened, but hopefully that's going to be happening any day now. And every day I look at those numbers coming in to see.
Yeah,
And we will often notice the change here before the state does, because we're looking at the actual new cases each day, because we have to assign them to contact tracer. So it's.
What is the status of the booster shot?
So the booster shot right now is approved for people with severe to moderate immune deficiencies, such as an organ transplant with immunosuppressed drugs, or people getting chemotherapy, hematologic malignancies that affect the immune system, such as lymphoma or leukemia, getting immune suppressing drugs for autoimmune problems like rheumatoid arthritis or Crohn's disease, people who have to take prednisone at a certain amount daily. So we are giving those vaccines to that group. For the rest of us who have had both doses, there has not yet been a determination that giving that third dose is really necessary at this point. The expectation is that in the next couple of weeks, there's going to be approval for at least the most elderly, like there was in the beginning, some nursing home patients and the elderly who are highest risk of both dying from the COVID and their immune system may not have responded as well to the vaccine as a younger, healthier person, which is no surprise. As we get older, nothing else quite responds the same way. So those groups will probably be approved. The question becomes, how about other people? So an average middle-aged person, when can they get it? And so those guidance will come out at an operational level. If we are responsible for giving third doses to 1,000 nursing home and over 60 people versus on that first day, we have 7,000 residents of Jefferson County wanting that dose. It's operationally a bigger deal, but we have a better system for doing it than we had a year ago, and there are the drugstores and the medical practices that are able to do it. So, and we have the information already in our system.
Isn't there a test to test for the amount of antibody that we all have in our system?
So
If we've been
there is a
vaccinated?
test for it, but we do not recommend it for medical determination. Research-wise, it was helpful to see that the people with organ transplants had very low levels of antibodies compared to other people who had been vaccinated. But by giving the third dose, it boosted those antibodies to meaningfully protective levels. Because the antibodies only measure one aspect of our immune response, they're not considered the whole interpretation of what our risk is. So we don't use that to determine whether someone should get another dose.
Dr. Reedy, can I add some more to your to what you just say? So we do measure antibody, we do memories, and what you call active antibody. However, we don't know how much antibody is actually enough to protect you as of now. So what we do is we do antibody tests and we're collecting data, and then at some point, let's say 1 year, we say, okay, so this much of antibody, how many thousand units is enough to protect a person. Then by then we will have a range and say, okay, so if you have this much antibody, you're good for a while. So as of now, we do have the test, but we don't have the range to say that it's actually protecting you. Does that make sense? Because you can have antibody, but it's not enough to, to fight a disease.
Well, it's same could be said if I were low, might have some of the virus in the body, but not enough to make
Well,
you sick.
Well, yes. So that's your white cell, your defense. If it's weak, you don't have enough antibody, then you wouldn't be able to fight the virus. So that's why the lab or the CDC or our healthcare provider have a range, a specific range to say, hey, you're good to go if you have this much antibody. Okay, that's all I have. Sorry.
Thank you.
No, thank you. Huh?
It looks like Caleb posted up some, I think what Elliot was talking about, but I think we've agreed to maybe take
So
that.
I can just clarify this. So what Caleb posted is that the CDC is recommending that people move from the PCR test that looks at COVID to one that also looks at influenza. And many of the urgent cares and hospitals are already doing that, have been for months, is that their report will show the presence of influenza A, influenza B, respiratory syncytial virus or RSV, or COVID. And so far, the majority of the results I've been seeing are COVID, that are positive are COVID. We see an occasional RSV, which is not usually a summer one, have not yet been seeing the flu, but that's going to change. So get your flu shots.
Yeah, but the the point of the PCR test is that it's completely dependent on the human being administering it. Because if you go over 40 cycles on the PCR test, you can have a kumquat come up with, be tested positive. If you keep, it depends upon the number of cycles that you set the test at. Because the inventor of the test, his name is Kerry Mullis, he says that it measures the entire universe of what's in that. If you keep running it, you will find something of what you're looking for. So that's the problem I have with the PCR test and its reliability. It's dependent upon the people administering it and interpret.
So that's not a view held by the majority, that there are standards for at what point.
Well, how many
something's
cycles
interpreted.
are we running the test at?
So each test is different. There are different technologies of the types of PCR tests. So when I talk to the pathologist at WVU regarding different test results where one shows one and one shows the other, he goes back and looks at the specifics of exactly how those are done, and some don't report cycles. They use other types of units so that it becomes very technical.
But what's the standard? That's my question. There
That's
has
the-
to.
Elliot, I
the
think-
standard
I think
is
one of
for
the
each
things-
test.
If I might just pause for a second, I think we already agreed to take this offline for you guys to
Okay.
discuss. It's highly technical,
Okay,
a lot of information out there, and I think just for purposes of time, we'll move on with that, because we still have quite a bit to cover, so.
So
thank you. I'm fine.
And that was the end of my slide and update on the vaccination. So we're in the midst of a significant number of cases. We have had, fortunately, relatively small number of classrooms that have had to have everyone out. We are seeing increased numbers of cases where 30% of our cases are under age 20, and that's across the state. About 8% are 4 and under.
Thank you.
Thanks. I also, like, I don't know if anybody else had the chance, I was looking at this last night, the ESA newsletter that Gillian had sent out, like, I guess they do they do it weekly, monthly?
He's doing it at least monthly, but sometimes it's 2 to 3 times.
Okay.
during the month.
I thought it was really helpful because it also showed like a regional snapshot, so versus the state stuff. So I just encourage anybody, if you have extra reading time, to take a look. I thought it was really informative. So thank you for sending that. All right, urgency authorization order. What's that?
Dr. Reedy, do you want to speak to that? That's what you had discussed before. I don't have the specific details of when it was approved.
Oh, so the about the Pfizer vaccine. Is that-
No, no, for you, the health officer.
Oh, I'm sorry. So back in April 5th, I believe, of 2020, there was an emergency Sunday meeting of the board when this had been declared a hotspot, and the governor had directed the boards of health to respond, including coming up with regulations for indoor occupancy and other things. And to do that, the board voted that the health officer would speak for the board, essentially, because some parts of things will say the board, and some will say the health department, and some, so it's become confusing. And so the premise of that order was based on the governor's state of emergency, which is no longer in effect as of the spring, and the hotspot designation, which was no longer in effect a year ago. So just to take that off the table, just so people are clear that that order from the board is no longer in effect. I don't know if it needs to be formally discontinued, but the premises for it that were stated, neither of those premises are in place anymore, and that order has not been used. We've been pretty much since then just going by the governor's mandate. So after we had the Eastern Panhandle had come up with indoor limit sizes and other things, Gilead. Then later, the state developed very similar guidelines.
So for clarity, it gave you authority outside that you would typically have to get from the board, is what you're saying.
Yeah, so basically allowed for him to make certain decisions without having a board meeting to approve those decisions.
So very, it was not used very much at all, if at all. There were, most of the mandates were under the governor's orders. So that, but that's just, in case that comes up, it's like, that's no longer in effect, because I've had that question.
So is that the language was in the order of when its effective date ended?
There was
That
no,
makes sense.
so the county commission had, they do their emergency thing for a couple weeks, ending at a certain time. This did not have an end date, but the premises for which it was, enacted are no longer in effect, so.
What was the date of the meeting?
Excuse me,
What was the date of the meeting that you got the?
I think it was the Sunday, the 5th of April.
2020?
It was about that time.
Emergency meeting.
I remember that.
Mr. Grow, do we need to rescind that? Do we need to make a motion to rescind that?
It was pretty specific as to the things that it covered. And if those things don't really exist, there's no reason for it. It
It's
was,
expired.
I think it has expired is what,
Mhm.
that's what Mr. Cochran told me a couple weeks ago. We were discussing it. It just had expired.
Thank you.
All well and good.
Yeah, it's expired 90 days from April 5th up to 2020.
Okay.
All right. On to the next agency report.
Other than COVID, we have been doing our usual family planning, childhood immunizations. Did not have the rush for childhood immunizations that we've seen in prior years, where 1 week before school, every kid seems to meet their shots. One piece that's not here, that's part of the COVID, is that we have hired part-time, primarily registered nurses and LPNs to be doing our contact tracing, to try and reach each person who tests positive. Statewide, this is a challenge for, if we can't get to cases, we're referring excess cases to the state, who has additional people that statewide, this is an issue. There's so many cases suddenly. Still doing tuberculosis skin tests, people who have sexually transmitted diseases that are referred to for evaluation and treatment. We see them. Waiting on Narcan to arrive from the state, so we can start distributing that again to people who need it. Flu vaccine has not arrived as of yesterday. When it arrives, we will start announcing that, and we're contracting with a couple businesses who wanted to have us give vaccines to their staff. And that will be in collaboration with some of the staff who had also helped us with the COVID vaccines. If we suddenly have to start giving thousands more third doses, we'll be getting our volunteers to help again. Very beneficial for us.
If people is the flu vaccine, like I know if I go to Walgreens or whatever, I get my I guess my insurance covers the cost. Do people get charged if they come here to get their flu vaccine?
They will get
free
charged. So if they, I can't give all the details, but there are guidelines for low-income people. We do charge the insurance companies. We do have some free vaccines, but we are expected for our services to charge people for their service unless they clearly meet a poverty guideline. So those are, so it's not simply free care.
And health administrator, we've hired, we have 2 positions. We're working on hiring 3 more now, so we're just waiting for that from the Department of Personnel. We've already submitted our requisitions. It's been about a week. It's been over a week, I think, since we submitted the requisition for the administrator, so we're just waiting to see who qualified as an applicant. We have a specific person that we've been speaking to and we interviewed, and his application is in there, and he did get notice that his was approved. So hopefully soon we'll actually have that list then.
And he is participating in the meeting today.
Oh, great. Hello.
That's really good news.
That's wonderful.
Welcome.
Now we just need the office assistant.
I have a question. I was signing checks actually yesterday, and I saw that we were refunding somebody's food. I guess it was like a food truck permit. I sort of commented to Wendy. I said, it's kind of, I guess the guy had sent it in, then he decided he didn't want it, so and it still had to go through the system. Do we typically refund like that? And I mean, for me, it's like there's still staff time that's being utilized. So if somebody submits their permit, should be not-
Refunds do have to be approved by the administrator. That was run by me before, and that.
No, I know,
we do hardly
was.
ever refund
Okay,
that type of thing, but
okay.
in this instance, I did approve it.
Okay, I just didn't know if that was common practice or if there's something we wanted to maybe take up as an issue because
It's not many.
it's not typical. Okay. It's like, there's a lot of staff time in that even.
Just processing the application and then. the payment.
All right, anything else on in that section of agency activity? Okay, financial reports.
I just got this today, so I must have missed it. Did you send this
It was
out?
sent with everything else.
Yeah, she sent it
Yeah,
last
I
Friday.
missed it. Oh, sorry.
What is this prior period adjustment? OPEB, is that from a grant of $200,677?
Where are you looking?
Second page of the balance sheet.
Back of your first page.
Back to your first page.
Your fire.
What is that? What is OPEB stand for?
I don't even see it.
Are you on your?
Okay. Okay. When Marty sent this out, she said that this was a draft and we were waiting for the new firm that we've hired to remove some old accounts, I believe. I don't know if that's what that is, but I would have to ask Marty. I don't know what OPEB stands for.
Do we need to take action on this report today? So if there's still some clarifications, I would say that we maybe want to delay that to next month until we have some of these answers.
I think we can do that. Yeah, because I don't know what OPEB stands for. She did say that this was, when she sent it out, she was still waiting on some action from the new firm, and I don't know that, I know somebody from the firm is here today, at the same time this meeting is taking place.
Yeah.
I'm having
So
so
I couldn't
much
meet with
trouble.
them.
I'm having so much trouble with you reading it. I'm sorry.
But I was just saying that Marty said when she sent this report out that she was waiting on some action from our new firm that is helping with financial things that I do not oversee. So they're here today, but they're here at the same time as this meeting, so I couldn't meet with them.
Okay. So who would normally, I'm new here, so who normally presents the financials of each meeting?
The administrator.
Administrator.
And that would be you.
Yes, but the
The
As,
chief,
as the acting administrator, I specifically said that I did not have the ability nor the expertise to do the financial aspect of this. So Marty has continued to do that for us,
Okay,
but she's unable to attend these meetings.
she's on, oh,
and we've hired an accounting firm to start
I can see
helping with
it.
this, and we're in that transition mode right now.
okay. So in future meetings, we'll have somebody.
We'll
to
have somebody
present.
else. That's why I'm saying, let's delay if there's any action that needs, or that you're asking, I think delay it until next month, once the county one has their
So moved.
shift happening.
I've
I'll
got
make a
one
motion.
question.
Oh, one sec, I think we're,
It's the contracted personnel, is that only the accounting firm or are there other individuals?
No, that contract personnel is most likely, some of the contact tracers are,
And,
listed.
And Nathan's.
Yeah, if you want to go through it and whatever questions you have, so we can get this addressed for you before the next meeting.
my only other question is actually outside of this, and that is, do we know the status of the request for the ARP money?
Okay.
Do we know, have we gotten an update from the county
I
commission?
don't believe so. no.
Well, my question is like from the 30,000 foot level, and that is that since we're funded by the state, how do those funds get dispersed to the agency, and to the department division?
As far as what funds?
He's asking about the state funding.
The state funds this,
So they do it based on population.
but I mean, just a mechanism, they do it monthly through
They do it-
transfer,
They do it quarterly.
quarter, okay.
What's
So,
up, Clyde?
So Clyde is with Cox Holiday Young, Clyde Young, and he can't answer that because this is Martin's report, but he's helping in the, so we are changing over the payroll and other aspects. So we'll have to.
Yeah, to be completely honest with you, what we are focusing on right now is payroll. And we're focusing on payroll right now and trying to get that transferred over without any hitches. So it's a pretty tedious process. You got, accruable benefits, which would be your sick, your vacation. You've got the retirement match, and based on your hire date, there's different rates for that. So we're trying to get all that figured out. And, payroll's mission critical because you've got 15 to 20 auditors on any given payroll, checking their paycheck, looking at this, and we're really, taking our time. And we have the luxury of taking our time because Marty is still here, and the way that the transition is going, we can afford to take our time and really focus on one piece and kind of methodically move across it. If Marty had up and left us, we'd be saying, oh crap, what are we gonna do? Like, we don't have anybody that's even sitting in that chair. And I know she's at a limited amount of hours, but there's still somebody at that capacity, in that chair. And we're going to start switching over and taking more over the financial stuff, as the months proceed. We just haven't gotten to that point yet, and there's other issues that we've kind of stumbled across as we go, like everybody that produces an invoice also has access to the QuickBooks. Do we want that? There should be one centralized person. So once we figured that out, we're like, well, we can't just take QuickBooks and put it onto our system and cut everybody out of this invoicing process. But there's a lot of things that we have to just really take our time and figure out as we go, because if we start severing stuff, there's unexpected consequences that we're slowly figuring out or that we're coming across. And maybe nobody in this room knew that either, that there's every person that writes an invoice is in QuickBooks and has access to it and could change something. So.
My goodness.
Yeah, I don't want to deal with that.
but remember to tell them that we've had some extremely clean, gleaming audits in the past few years too. There has been no evidence of any malfeasance.
Yes, but when you say that anybody and everybody's in there, that's just your controls are weaker. It's not that anybody did anything. We're not here to accuse anybody. We're just trying to say that, hey, I came in today and Marty has left a message that she needs there's how many people in this building? 15, 20 probably, any given point. There's 7 people that want QuickBooks access. Is that what we want? You know, I don't know. I mean,
It's
I was just shocked.
6 of our staff.
6 of your staff.
6 of our staff.
And then we would be the
It's
seven.
the administrator, the financial assistant, and 2 office assistants up front, and the 2 environmental office assistants.
How long do you think it's gonna take you to whip this thing into shape?
Well, first payroll is September 24th. That is my goal. The reason that September 24th is such a big deadline, our payroll processor will not do the quarterly returns without running one payroll in the quarter. So the quarter is gonna end 9/30. You know, what we're putting all efforts to is to run this first payroll with the payroll processor, 9/24, and then they would relieve the pressure of doing those quarterlies. And all we're trying to do is just pick pieces that we can pull and outsource. You know, like payroll, right? Every payroll, they're logging into West Virginia withholding, unemployment, they're calling in the 941 payments. With our payroll processor, all that gets done outsourced, you know, much more efficiently. And what we can do is use other people's time more efficiently. You know, like Marty can focus on these grants if that's what our goal for her is, that, you know, need to be done. So we can pull these things that are not like so knowledge based like a grant is, right? It's really hard to say, hey, let's outsource some grants. We can outsource payroll much easier. It's just, it takes time to get everything right. And there's a lot of pieces in payroll that can get lost in translation.
There are compliance issues.
Yeah, there's compliance issues. You know, there's things that we've already fixed. You know, we looked and said the pay stubs, like, why are certain people say salary? We thought pretty much everybody was hourly. And they're like, well, we put them in QuickBooks as salary and the payroll say salary. Well, I said, well, that's different than what's on their employee file. We have to match the employee file to stay in compliance.
Because this payroll service, you're saying people, many people are hourly. Is there a way to automate that with, you know, time clock in and clock out procedures?
There is too. Yeah. And you know,
is the current staff using any of that? Like, how do you regulate how many hours?
We just have paper logs, and we find it, and they keep track of their hours on their time sheets.
and this is how wild and crazy it gets, Dave. Some people were given their timesheets monthly, some people bi-weekly.
So
That's the part-time employees that do bi-weekly, they had to do it that way.
but if they're given timesheets monthly and they're getting paid
bi-weekly,
how can those be accurate?
Hard to reconcile that.
And
That's what.
we'd have to do 2 different ways.
Reconcile
Yeah.
that, so because we are
Very hard to
switching, that
reconcile.
was the whole point of them only getting paid for 1 week, so now they're having to submit their timesheets every 2 weeks.
we're making that change. I'm just letting you know what's going on behind the scenes as we come in and we find out. And
I'm glad you're on the case.
well,
So
here-
is there a software program that can be offered that there's a laptop that they've got to put a fingerprint? I've had businesses actually, you've been a part of those for accounting purposes. I've had businesses that use eye or finger recognition for clocking in and out.
there are several options we can use. We can get a real time clock that you have to be here present. And then you can do with browser as well, and they can work in conjunction.
Would that speed up your efficiencies of having to go through these paper logs and figure out payroll?
Honestly, it won't hurt me because I'm not doing the entry,
But it was
Wait.
somebody staff clerical would probably speed up.
but we have to do baby steps. You are 100% right. We've got to at least get everybody sending in the same 2-week report first and then work our way to that. But yeah, what you're saying is definitely the future. We can get there, but you can't go from here to all the way over here overnight with what we've got.
Could your firm send us a proposal based on that for us to review?
I was gonna say, what if we have them on the agenda for next month to give us sort of the latest and sort of see, if they've had time to transition?
Yeah, we
get us
already have a
updated.
contract with you.
Yeah, let me do this. I can come to the next one and we'll have one payroll rate.
Yeah, just to kind of hear what sort of they
No, that
figured
sounds
out.
good.
and then-
Yeah, that would be wise.
Thank you for introducing
And they,
us.
he will also be the one in the future, at some point, providing the monthly reports. So if there's specific things you need in that as we go through it, he's the one we'll be talking about, correct?
Is Jonathan still here?
No, he's not.
It will be me or Charlie.
But your office.
Somebody from our office, and Charlie is also a CPA.
So.
I am really more like up to speed on the payroll stuff and getting it into our system. I would say Charlie is a better governmental accountant than myself. She's got a little bit more experience auditing governments. And I'm more of a small business tax guy. So what I'm trying to do is get everything pulled in and get the processes up to snuff. And then as far as the accounting and financial stuff, she's probably going to do a good portion of that. But until we get there, there's no point in bringing two people and wasting resources. But yeah, it's the problem, Dave, with what you were saying is how accurate they are. Everybody was getting paid the right amount. I have really good confidence in that. But trying to figure out PTO balances when you're using numbers from a month ago and what you use for PTO, and then Wendy has to go back and make adjustments manually because they're not on the paycheck. So that was like a big surprise.
Well, it could absolutely be for this board, it could be a liability and compliance that, you know, we accidentally didn't give somebody the right amount of pay time off, or we didn't compensate them properly.
Or too much.
And if Mr. Groves on here, it could be major liability. So.
Well, good points, yeah.
Well, if we can add it to the agenda for next week or next month.
Yeah.
To just get the latest and update.
But the
What
good
about
news
these
is
travel expenses? How do you guys do paper logs in on that weekly, or?
we have not done anything with the fine. We are still working on payroll and trying to get that in.
Well, should that be part of payrolls like that? Is that check getting cut separate, or should it be on a payroll check?
It's separate because you can't take taxes out of that.
Right, but is that compliant with federal payroll guidelines? Yes, okay.
Well, those travel expenses are not on the W-2, right?
No, they're not.
Yeah, so they would not be required to run through payroll. You can always do some sort of reimbursement for travel expenses on payroll that's non-taxable.
Right, an expense report, yeah.
But whatever your policy is on that is what we would want to do. Like if your policy says, hey, we want to run that through payroll, we do it. If you like to cut paper checks every week for whatever travel time people have done because you like to get it weekly to people instead of bi-weekly, that's cool too. It's just what policy do we have in place, and we just need to stick with it.
The travel report is monthly.
So there you go.
But that's more of an operational decision, frankly. I mean, that's probably not a board decision, you know?
Thank you for your time. Nice meeting you.
Yeah.
Thank you. Thanks, Scott.
Your name's Tyler?
Clyde.
Clyde. Nice to meet you.
Nice to meet you.
So sitting here looking at this, Elliot, while he was talking, it shows the accounts receivable state allocation, I think for this quarter is 65,000.
Yeah.
And
gotcha.
that's about right because we get about $250,000 from them in a year's time, isn't that?
About, yeah.
In that general vicinity, and it is sent quarterly.
Right.
But I guess that too.
So that's why we need to get somebody,
That's why,
right, Jillian is stepping in and has done really a great service here by stepping into that role, but we need to get the right person.
Well, actually, Elliot, to give you some background on this, actually, that's why we have the firm doing the finances,
Yeah.
because we actually wanted to separate it out
Yeah,
from the administrator's role to find, you know, because administrator has so many other hats like HR and just basic management and grants and blah, 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 blah.
Right.
And so I think what Dr. Reedy and Gillian had advised is that, and Dave was great in pulling it together, is that we put the financial stuff, outsource that so that the new administrators can focus on the other.
sounds good.
Other
The prior
things.
administrator
Yeah.
was from a financial background.
Okay,
That was her special strength. But that's not.
Right.
fair enough.
Well, thanks for.
Yeah, thanks.
All right. Before we go to the, right now, we've got next meeting is scheduled for October 8th. I know I've got a couple of items just to address under new business, but does anybody have anything before I hop in?
Not at this time.
Okay. So I think we're gonna address Oh, sorry, Ann?
Oh, I want to ask Gillian or Dr. Reedy really quick to answer to Miss Monica Taylor about her question about quarantine. I guess she missed it from the meeting that we stated that we follow the CCD guideline for quarantine. But I just want to make sure we answer her email. And I think Dr. Reedy or Gillian are more appropriate than one of us, correct?
So if the question is, when will the quarantine be over? I think what you probably meant is, when will the special measures to deal with the pandemic be over? I do not know. I can make guesses, but this will be changing and try and give updates. But I can't give an answer, and I don't believe anyone else can. As far as long discussions about how to respond to the COVID, I'm not able to answer each person that sends emails, and we had quite a lot. Those take time if people want one-to-one discussions. And
Okay,
I'm not
so is there any way that is that we say on our website that we follow the CDC guideline? We need to have a place that people can get information.
The state, we are following CDC guidance. We're following the state recommendations, which follow CDC guidance. We are also following, for schools, WVDE guidance that has been put out. So there's separate quarantine guidance for schools, only because in schools they are allowing, if the schools have a mask mandate, then not everybody nobody has to quarantine if they were all wearing masks and one person is positive. So there's separate guidance for classroom settings in schools than for other situations.
All right, my question is, can we put that online so that way people?
We can, we're trying to update our website. There's a lot of work going into that right now. So we could use one person just to do website maintenance, but for updating the website. But right now we have a part-time sanitarian and she's the one who's been working on that.
So question for you, like in something like Ms. Taylor's email where she's looking for a response, and it's probably, I don't remember her email specifically, but obviously it's on this topic area. Would it be possible, just from a process standpoint, so, you know, a common question like that, to put like maybe the answer on Facebook, you know, saying we received this question regarding quarantine policy, this is what we're following, or whatever the answer may be, so that we're responsive. But it's all probably a question that a lot of people have.
So I think her question was more like, when is this going to end?
Right.
We don't
Well,
have an answer to that.
And that's okay to say we don't know that, but we continue to follow West Virginia Department of Education guidance, CDC guidance, whatever the guidances are. So even, I mean,
That's
I think-
why I asked the food questions.
Yeah.
I think that I was trying to get at that.
Yeah.
For her. And I think if you could come to the next COVID report with some analogies to the flu, that might help analogies might give people a better understanding of what their future environment is going to be like.
but specifically, can we also make sure we get back? I'm just trying to sort of like say, okay, if we get back to Ms. Taylor, you know, she asked for that, and I think we should be respectful of responding. But then if it's a general question, maybe also if it's easier to post it on Facebook so that the information's there. And I think if anything in pandemic and that we've learned is that the answer being I don't know is actually like, I mean, it's, I'd rather say somebody say I don't know than tell me something wrong. And so we obviously clearly don't know when this is all going to end. So why not state that?
So we do answer quite a lot of questions every day. I do not remember specifics for this person, but some people have long emails with multiple points that they're making that's going over, that want to discuss things that are discussed quite often.
Mhm.
And it's, I'm not sure, where you go with that.
Sure.
I think we don't want the public to feel like they're being ignored. I think that's.
And we certainly aren't trying to ignore anybody. We try to answer as many questions
Right.
as we can every day. So
So
I
can we
think
be-
she feels ignored for
Right.
11 days, absolutely, or 10 days.
Can we, like, for specifically her request, I mean, she's taken the time to write. I don't know if she was at the Saturday meeting, I don't recall, but now she took the time to show up this morning again, so can we at least?
I'd like to make a motion that the staff responds to her by the end of business day today. Can I have a second?
Second.
All this, I'm sorry, any discussion? Those in favor?
Aye.
Aye. Opposed?
Aye.
And then under new, sorry, I think we've handled that. On the second item was the video, coming back to the discussion about posting video. So, yes, do we need to take a motion that will assign a small working group of me and Elliot?
Committee.
Technical, do you want to join that, Dave?
Well, that will be out.
I think you can only have two
Oh.
on any
Sure.
committee.
Call
You
it a
can only have
committee.
two
Oh,
members.
really?
Yeah, so for open
Otherwise,
meetings,
there's
right,
a
okay.
quorum and you're not allowed to have that for committee.
I'd like to make a motion that a special committee of Karen and Elliot is created to create a plan that the video recordings of our meeting are posted online in a YouTube or a public setting, and that plan is in place by our next board meeting.
I'd like to amend that
Amend it.
to say that we also will take on the responsibility of getting those posted until staff is available, until there's enough staff capacity to handle that.
That is the additional amended motion.
But is it appropriate for me to second it? Yeah, I'll second it as amended.
All right, any discussion? Those in favor of the motion as amended has been stated, please say, those in support, please say aye.
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 Opposed? On the previous question, were you abstaining? Because I didn't hear A. Aye.
I just didn't talk. I'm fine.
So are you abstaining? You want to be marked as abstaining?
No,
or
I'm fine.
Aye, okay.
And who are the two committee members?
Karen and Elliot. All right, any other items for new business?
And the next discussion, I'd like to go back to the payroll thing for liability. I'd like to have that on the agenda.
So, so do you want it as a briefing from the accountants, or do you want it, do you need a liability assessment?
I think we should get both.
Okay. Steve, did you hear that?
Do you think it would be worthwhile to put the quarantine subject on the agenda for the next?
What do we need to discuss on it?
Good picture of you there.
Well, to clarify, because that seems to be an issue over at the Board of Ed, but yeah, if you don't want to discuss it.
Well, I guess I'm not clear what the request is, that's all.
Well,
I'm
just
just asking.
who sets the quarantine policy and why?
I think Dr. Reedy suggested that it was West Virginia Department of Education or if you're talking about classroom.
But is it the state board or is it the county board?
So I'm not sure when you say quarantine, if you're using it the same way we use quarantine. So if
Well, that's why I'd like to discuss it in depth next time. That's just to get, we can then define it, we can decide who's doing it and why, and what our role is.
so we can,
Exactly.
Do you want it specifically for schools or are you talking
Yes,
generally?
yes, exactly,
Specifically
for schools.
Okay, that helps.
That, because that was the question that Monica Taylor had, it was about the quarantine. So you can just respond to Monica that we are going to be working on clarifying what the issues are, so.
And the school also posts all of that in their, they post that for all of the parents
Right.
as well. So parents have access to exactly what their quarantine protocols are.
Because if we have no role in that, then we don't need to discuss it.
I'm not sure that we have any role.
So we have a
We have a
role.
limited role.
Okay, so then,
We have-
let's discuss it next
We
time.
have a role with quarantine. That's our
Okay.
responsibility.
Okay.
We work with the school system, just like we work with businesses and nursing homes.
Alright.
It's,
So then,
there is a-
that would be worthwhile discussion item for next.
But we as a board do not have a role in that. That is
No.
basically Dr. Reedy's decision to make.
Correct. It's a focuses on a small group of people potentially exposed to the disease, and what's the reaction? How do we?
So who vests that authority in you? Is it this board or is it the state?
State.
Okay.
The state.
So then we don't have a role.
Correct.
Yeah, we do.
The
Just like
state.
you don't have a role in how I treat someone with a sexually transmitted disease.
Right.
No.
Okay, so then take it off the discussion item because we don't have any, we don't have any jurisdiction over it.
Okay,
So we want to maximize number of days that people can have in classroom learning, because that has a whole benefit.
So I mean,
Minimize the number of
when I was a kid,
cases of
when I was a
transmission
kid-
within the school.
when I was a kid, if a kid got measles, you sent the kid home until they got over the measles, right? And that was the end of it. And you can call that a quarantine, I suppose. But I mean, that's in essence what we're talking about here, because kids generally, it's not a fraction, die from COVID, right? That's almost statistically, not an issue for kids. But anyway, I'm done. We're good.
sure,
Right?
sure. Yeah. Okay. All right, is there a motion to adjourn today's meeting?
I
So-
move we adjourn.
Second.
All right, discussion, all those in favor say aye.
Aye.
All those opposed. All right, thanks, everybody.
Bye.
Enjoy your Friday.
See you.
Bye, Ann, good to
Bye.
see you.
Good to see you.
We didn't come back to, I guess he was just going to